Okay.
Good evening, everyone. Behind smiling face can be a heart which is difficult to read and interpret. It is difficult to understand for us the turbulence in people's mind. But believe me, it's okay to feel unstable, disassociated, hide from the world, and ask for the help. It's not okay to be okay with the note. I would like to welcome you all on behalf of Norvic International Hospital to CME program on integration mental health into primary care presented by Dr. Ira Naim. Now I would request Dr. Pankaj Jalan, Medical Director of Norvic International Hospital, for the welcome speech.
Good afternoon, everyone. So the World Mental Health Day was celebrated just a few days ago on 10th October, just a few days ago. And the theme this year was to make mental health for all a global priority. And to take this message forward, we have a very eminent clinical psychologist from Dubai, Dr. Ira Naim. She has been trained in Pakistan, UAE, USA, and Ireland. So without wasting much time, I would invite Dr. Ira to give her deliberations. Thank you.
Good evening, everyone. I'm Ira Naim. I'm a clinical psychologist, and for the past 10 years, I have been practicing as clinical psychologist in Dubai. And originally, I'm from Pakistan, so I'm genuinely very grateful for Norvic International, Mr. Basant Kumar, and Ms. Megha Chaudhary for inviting me here and giving me this opportunity so I could share my knowledge, my perspective about mental health with all of you. And simultaneously, I would love to learn from all of you, as I believe most of the participants belong to medical profession. Yeah? Okay. How many doctors we have today here? Can we raise our hands? Okay. And how many nurses we have? Okay, we have very few nurses, but great number of doctors. So definitely I would like to learn from all of you as well, like what are the practices view. Okay, so without wasting time, I would like to start the presentation. And the topic we selected, it was more of like integration of mental health into primary care. Okay, so just like before starting this event, I was having discussion with media person, and then they were like, why this topic? Okay, so let's say I have a question like, why this topic? I'll give you this example. So let's say like you, what's your name? Ansu. Okay, Ansu, imagine like you have headache, constant headache, and you have stomach issues going on, and you feel nervous most of the time, and you have been vomiting, but it's not getting better. And you go to your mother and you ask your mother, I have been experiencing these symptoms. What your mother is going to say?
Drink water and sleep.
Okay, drink water and sleep. She'll give you some home remedies, and if it doesn't get better, what's going to happen next? Let's go to? Yeah, she will say, let's go to a hospital. But when she says, like, let's go to a hospital, what is she going to say? Which doctor are we going to see? Physician, definitely. So when we are having these symptoms, the first thing we have, let's go to a doctor. Okay? Then we go to a doctor. Here is the role of our medical practitioners, general physicians. Like, patient is coming again and again repetitively with all these symptoms. They have been trying all the medication. So then they are the one who are going to identify, okay, maybe she's having panic attacks. Maybe she's having anxiety because the medication I have been prescribing is not working. Okay? But if I go to my mom, let's say, now my mom is more aware because I work in this field, but back then obviously she'd be like, are you like crazy? So if I go to my mom and tell her I'm having panic attack, she'll be like, what's that? And she's never going to offer me, let's go to a psychiatrist. Why? Because in our region, we don't have awareness about mental health. Okay? That's why today I really wanted to bring this topic here so we all can learn that, okay, the first hand option we always have, let's go to a doctor, let's go to a physician. So what are physicians? What's their role? What they can do to promote mental health? So that's why we selected this topic, okay? I'm not a big talker because as a psychologist, my job is more of like to listen, okay? So because we're having a presentation, I have to talk. Otherwise, I'm not a talker, okay? But wherever we are having any training, I would like to make it like a more of like a interactive. So please, you all expect questions from me. Okay, and no need to feel shy. Whatever answer you know, you can always share that with us. Okay, so can we distribute mics, or maybe somebody can be here with different mics? In the presentation. Because I want to intro. Yeah? Can I be here? Yeah? Okay. It's fine. Okay. So today we are going to cover different topics under this heading. So we'll have an overview, what does it mean by health and why the integration is needed. We'll have a view about association between physical and mental health challenges and recognizing and treatment of mental health problems in primary care. Then we are going to have a look at different models of collaboration we can have between these two settings. We'll have a look at what are the behavioral challenges our physicians they tend to see quite often, and what are the mental health challenges that they can treat easily, and they are allowed to treat that. Okay? And obviously, when we are going to have a look, okay, you can do this, you can do that, but then there is always an option. I want to do that, but I don't have resources to do that. Right? So definitely for any type of services, there are going to be some restrictions, some limitations, so we'll have a look at that. And then what you can do, whatever resources you have, I would like to teach all of you like a few of the what's your role in that? Okay? So I would like to ask the medical director, what's your perspective or what's your definition of health? How do you define it?
So, health is both physical and mental and social well-being.
Social well-being, that's good. Okay. What do you mean by social well-being?
The patient, when the person is able to interact with his family, with his friends, with the society, with his community.
Yes, definitely. So when we talk about health or we talk about being healthy, it means feeling good, well-being. I feel good. I feel okay. That necessarily doesn't mean that I don't have any disease, because sometimes we have some physical health challenges and body most of the time is not in our control, because this is how internal system is working on. Okay? So the health means, health is a state of complete physical, mental and social well-being and not merely the absence of a disease. Okay? When we talk about health, we talk about the body, we talk about mind and our connection, because human beings are made to connect with others. We have the basic need of connection with our loved ones. Okay? So health means I feel good in these three perspectives. But obviously, like when we talk about specifically South Asia, we see that we have a huge stigma associated with mental health. Because whenever we watch any movie or we talk about or we see somebody on the street, mental health is more of like, are you crazy? Like we are being perceived as crazy. But you don't have to be crazy to go to a psychologist or to a psychiatrist. Okay? So to be healthy, mental health, physical health, both are as important, because both are interconnected. Imagine you have like a very healthy body, you are like having good muscles, good health, but you are experiencing maybe personality disorder or bipolar or depression. That does not mean that if you're physically fit, you are healthy. So both aspects of our health, they go hand in hand, and definitely to improve it and to sustain it, we need to have social connections, good well-being in terms of social. Okay, so let's talk about Nepal, because Nepal first time, like I always read about it because of Mount Everest, everybody knows Nepal, but the first time Nepal actually got my attention, it was back in 2005 when there was a huge earthquake and I was a student back then. So we started that project. We wanted to learn like what are the psychological impact as a result of any natural disaster, what people they feel, because it's something out of your control. You didn't make it happen. Okay? So back then it was very interesting for me to learn, and it was obviously very devastating. I'm not sure like if the impacts are still there on the social economic position or you guys have come out of it. Okay? But for me, like when I connected with Megha, it was really great to connect with her, and she was like, okay, let's do this in Nepal. So when I looked at the data, I'm sure most of you are aware with this, like there was a national mental health survey conducted by WHO January 2019 to 2020. I'm not sure how they managed to do it during COVID. But there are some very interesting findings that I would like to share or highlight here. First is like among the adult participants, 10% had any mental disorder in their lifetime, and 4.3% currently has any mental illness. Means 10% had experience and 4.3 current. The prevalence of suicidality, including current suicidal thoughts, lifetime suicidal attempts, and future likelihood of suicidal thoughts was found to be 7.2%. The prevalence of lifetime mental disorder was the highest among adults. It was 13.9, and among 40 to 49 years old, 13.3, and among males, 12.4. For me, as a psychologist or as a researcher, this finding, it really got my attention. Like, why it was highest between this age group, 40 to 49 years old. I started to think about it, why? Like, why not adolescents, or why not somebody in their 20s or in their late 60s? So first thing came to my mind, because I live in Dubai, I see so many Nepali people over there working. Okay, so maybe I thought the younger population, maybe they go abroad, and that's why they couldn't participate in the survey. So here I would like to get some feedback from maybe you. What's a good name?
Dr. Pommy.
Dr. Pommy. Yeah. Why do you think it was more highlighted or high between this age group, 40 to 49?
Thank you for the question. I think it's because as you said, the young people, they go to abroad, and these 40 to 49 age group people, they stay here, and they were more depressive about the consequences. So maybe that was.
Yeah. Anybody else would like to add something that maybe we are missing? Okay, so first of all, definitely the sample size, it impacts, maybe they didn't have many younger people, or maybe the sample size was not equally balanced. So the second is midlife crisis. Okay, midlife crisis means once you have hit your 35 to 40, you just tend to look back at your life. What I wanted to do, what I did, what I have, and I am about to die. Because that's how our culture is. The moment we are in our 40s, we are already old. But that's not true. Okay? So here, the midlife crisis hits more. Okay? So depending on whatever socio-economic situations have been before, maybe they are experiencing more depression comparative to adults or younger population. Because younger population, maybe they are in abroad, or they are studying here and there, getting to know more hopeful. Okay, so maybe you just need to pay attention to your parents. Okay, so when I had a look so the prevalence rate was 10%, and the current was 4.3%. But when I had a look at the data, what's the human resources of psychiatry in Nepal, so it was very shocking for me to see. I'm not sure if this number is accurate, but that's the research I found. Maybe you guys can really correct me. Clinical psychologists 35 overall, so maybe they're talking about the government hospitals, government facilities, and psychiatrists 147, which is the total population of 0.12, and psychiatrists to 0.5. So if you see the number of total population, and out of total population, how many are experiencing psychiatric challenges? So this number of doctors are not enough to meet the needs of our general population. It means demand is more and supply is less. Okay. Now let's talk about association. What's the association? Why do we have to do that? Because if you go back here, and you see generalist doctors, 96.0, a total overall employment. So it means this huge number of population, they can really play their role in addressing mental health needs. So when you look at the data, overall, generally, and in Nepal, 10 to 20% of general population will seek primary care for a mental health problem. As in the beginning, I had given this example, I'm constantly having this physical sensation of anxiety, and what I would do, I definitely will go to my general practitioner. Okay, so because I don't know, I'm having anxiety or I'm having panic attacks. Okay, out of 1/2 or 2/3 of patients meeting criteria for psychiatric diagnosis go unrecognized by primary care doctors. Okay, now obviously our primary care doctors, they do their best, but maybe sometimes they miss 1 or 2 aspects, and person is going through something, but it's just unrecognized. 2/3 of primary care patients with psychiatric diagnosis have significant physical illness. Okay, like most of the patients with the physical illness, specifically like very unexplained pains all over the body or some physical sensation that you have done all the testing, all the tests, everything is fine, but still patient is experiencing that, it means they are experiencing some psychiatric challenges. So maybe that's the area we need to explore more. Chronic medical illnesses increase probability of depression. Like anybody going through any chronic illness tend to feel hopeless about the future because it's not easy to deal with any type of physical challenge for a certain period of time. Health status or life functional status correlated with psychological factors than physical diseases severity. Like as we spoke about our social economic situation, our social connections, that impacts our mental health more comparative to the physical health, because at the end we all eat and we all sleep. And good food and good sleep is so much important to maintain the physical health. But how about the mental health? If you miss the social part, you are really going to experience something. Now, how can we recognize in our primary care settings and what can be the treatment plan or how you can approach your patient? Here, primary care provider deal with patients' untreated psychological problems, identified or not. Now, let's say you are gastric specialist, okay, and your patient is coming again and again with IBS or some gastric challenges. You have to deal with that patient. Doesn't matter if you have recognized his anxiety or stress or no. You have to deal with it because that patient is coming again and again. So it's better that you just give a little bit thought about it. Psychosocial behavioral problems take up primary care provider time regardless of degree to which problems are exclusive focus of practice. 1 by 3 primary care patients will refuse referral to mental health professional. Imagine like you as a primary care physician have already seen, okay, this person doesn't have any explained physical problems. You'll be like, why don't you go to a psychiatrist? And they'll be like, no, I don't want to go. And again your patient is coming to you. So that time you don't have a choice. You have to do something about it. Patients who refuse referral tend to be high utilizers with unexplained physical symptoms. Then why do you have to do that? Because if you don't, then it's a duplication of effort. You are working so much hard and giving so much of your time and resources, undermines comprehensiveness of care and ensures that the patient cannot be completely understood. Like if you ignore the mental health part, it really compromises the quality of the comprehensiveness of your treatment. And the last one, growing evidence that integrated primary care is cost effective. Okay? And obviously specifically in countries like Pakistan or Nepal, cost is the biggest challenge we have. Yes, awareness is one thing, but the cost is definitely the other thing. So if you are able to identify the psychological challenge and you are able to treat it from your side, that person doesn't have to go to a psychiatrist and it will save some money. The conclusion, yes, I would like to know the feedback. Whatever we have discussed until now, he looks so interested. So, what's the conclusion you would like to give me from whatever we have spoken until now?
So you need your conclusion, whatever you have presented, or my understanding of mental health?
Like both perspectives.
Okay.
We are open to talk.
Okay. So, thank you. It's really nice topic. You have tried to integrate some of the things that has from your perspective. Some of the correction that I would like to make, I'm Professor Dr. Nilesh Sapota, so I'm psychiatrist, okay? That mental health survey is not conducted by WHO. Okay, it was not conducted. It was, pilot study was done in 2018 and the original study was done in 2019 and
2019, yeah?
2019
okay.
and 20 it was published, okay? So, it was done by NHRC in association with medical schools, lot of medical schools were involved, okay? Okay, so some of the data, what it is pertaining to other, I think, developing countries, I think you can see, but we do have some reservation of the findings because of some skewed type of, the analysis. Because of that, so that may not reflect truly what we get.
Yeah.
Okay, regarding the conclusion, definitely, being a psychiatrist, I would like to say we have three brains. So far as mental health is concerned, we have three brains. One is head brain, the other is gut brain,
Yes.
the third one is heart brain.
Yes.
Because same number of neurons, okay, same type of neurons are prevailing in all these organs. Okay, so if your mind is active, too much active, then definitely gut would be hyperactive. There will be a lot of IBS-like symptoms. There will be nausea, vomiting, or your even heart brain would be active. There will be palpitation. All autonomic symptoms would be there. Okay, so when I talk about mental health, I would like to talk about three brains rather than only head brain.
Yes, sir.
So now my understanding is why it has to be integrated in primary. So I think the primary care, what you are talking, especially in developed countries, we talk primary. But here, if anyone gets any type of problem, they do like to visit the renowned physician of that state or country.
Yeah.
They would not like to go to primary physician like GP or anyone. So that may not reflect to our situation. They would like to visit to a renowned physician, and they will be asking a lot of investigations, or they may have a lot of doctor shopping as well. So I think in our country like Nepal or developing countries, the concept of primary care physician, if we can enhance this, if we can implement, that would be great. That is why I think in 2014, government in association with WHO, they have started mental health initiative programs. Okay, so WHO has done, and they have, because the treatment gap is huge in developing countries. Like, if you see the treatment gap comparing developed countries and developing countries, it's a huge gap is there. So in order to, in order to seal that breeze, government of Nepal and WHO has started mental health gap action program gap. That module is there. So they have tried to integrate that module in primary care centers where we have primary health posts, district hospitals. So they have been trained. Okay, so I think if anyone from WHO here representative, or we have one who is from medical school but now he is working in one of the sector here. So that training is being provided. I think for Nepalese context that is better.
Yes.
Because, it is being done.
Can you know your name, please?
Nidesh Sampota. Nidesh.
Nidesh.
Yes.
So Dr. Nidesh, like when you talk about people would like to go to a very renowned physician comparative to primary care GP or in any, like let's say public health hospital, can everybody afford it?
Definitely not. That is why.
So then what are you guys doing about it? Like is that government or?
Okay. So if you have to talk from the government perspective, I think if any government personnel are here, they can be better person to answer. But okay, unless and until this awareness raising campaign or the integration of mental health in curriculum itself, nobody would like to talk about mental health issues.
Yes.
Okay? They would like to talk about all physical issues. Okay, so that is why government is trying to reach that population. And if you, I think more than 60 to 65% of the population of Nepal are dwelling in the rural areas still.
Okay.
So that integration government is taking this step.
Okay.
But in the metropolitan cities like Kathmandu, still the primary healthcare physician concept is not prevailing. They would like to go and visit to a big hospital or specialist without understanding the knowledge of the physical or psychological issues.
Okay.
Thank you.
Thank you so much for your feedback. And
Thank
you're a
you.
psychiatrist, right?
Yes, yes.
Okay, so we'll talk a lot
Thank
today in TD session. Thank you so much for your feedback. And definitely, as when I started, I give my background. I'm from Pakistan. So the situation of mental health and primary care facilities is kind of similar as Nepal. That's why I was like, I'm here to present my perspective, but I would like to learn from your perspective what's going on, because you will be able to like teach me something or add something to what we are discussing today. So definitely, like as he said, in the rural areas maybe government is trying to do, but this is the necessity. It's necessary to do. Like in many countries it's happening. That's the point we are talking about it today. So maybe you guys can have more thought about it and we can think about it, doing it in the future. Alright, so let's move forward. Now we know that, okay, most of the time physical illnesses are more necessary and we'll go to our physicians, but nobody would like to talk about mental health due to so many reasons. So let's move it forward, that what are the models? Now when we talk about collaboration, there can be different models, and so many organizations, they present different type of models and practice different models. So basically, like there will be 3 levels, level 1, level 2 and level 3. Now it doesn't matter that in your country or in your hospital, what model you are using, it's always, you know, we can always learn more, grow more, but these are the basic levels we will talk about. The first level is minimal collaboration. Minimal collaboration means that you work in a Norvic hospital, okay, and maybe Megha works in different hospital. You are a physician, but you met Megha and you know, okay, Megha is a psychiatrist. So one day, your one patient comes, so you can just make a referral. You just know that, okay, in that hospital, we have a psychiatrist available. So that's a very minimal collaboration. You don't have any mutual interest. Okay? It's a separate system, rarely communicate, maybe in conference one time you met Megha and you just know she works in Norvic. Mostly these are the private practices and agencies. Second is basic collaboration on site. Means that you are in the same facility. Imagine that you are like have same facility like Norvic, but you have a separate system. For example, I'll give you example, like you have a bariatric surgery department, but that department doesn't have any collaboration with mental health. For example, in our hospital, like I would just give a reference, in our hospital, whenever any patient is getting ready for a bariatric surgery to lose weight, has to go through screening by a psychologist or by a psychiatrist to give a, okay, like this patient is ready to go through this surgery, okay, to understand their emotional perspective. So in here, in basic collaboration, you don't have that. You just know, okay, there is a mental health department and this is bariatric surgery department. You share the same facility and no systematic collaboration. Misunderstandings are common. So over here, yes, you have a patient for surgery and that patient is very anxious and again asking questions about am I going to be able to lose weight, how it's going to be. So you observe that, okay, maybe this patient has a little bit anxiety about going for surgery. So you'll be like, okay, maybe you can have a screening with a psychologist or one session. Okay. Now the third level is close collaboration in fully integrated system. Very few facilities all over the world have this level or reach to this level, okay? Because this level, it all depends on resources we have, okay? Or the kind of approach you want to use. Because it's not easy to integrate it fully and to have the full collaboration, close collaboration. But I would like to believe so that we would all want to reach to that level. Okay, and in that level, we will have same site, same vision, and same system. Like where you make it, like in my hospital right now, where I work, most of the departments, like let's say 70% departments are kind of collaborating, but still there is a huge need that we need to work more for it. Okay? So now depending on the system or the organization, whatever you are following, like wherever you are, the point is just use it. Just give it a thought. even today, what we are talking about doesn't matter like you want to achieve level 3 or level 2. At least we are talking about it, so we will just give it a thought, okay, this topic is also necessary. Okay, so I would like to know, like so far from medical director, if we talk about these 3 levels, where do you see like right now most of the hospitals are?
Our hospital is somewhere between 2 and 3.
Okay, so sometimes in some cases it's 2 and sometimes it's 3. Yeah. For us also, obviously sometimes outdoor referrals are necessary to make because maybe we don't have diagnostic some procedures. So sometimes it's level 1, sometimes it's 2 and sometimes it's 3. Now, when we talk about the collaboration models, then the second thing, like not every doctor has so much time. I mean, you all don't have time usually. So what are the behavioral problems or challenges or physical challenges that go hand in hand? The most common. This list we are going to present is not the final list. It's just the highlighted. What I observe maybe in my practice. Maybe in Nepal it's a little bit different. But what I observe, this list is not the final list, but some of the main challenges we see. So, as a primary care physician or as like any other physical specialty, what patients you have to screen, like you are dealing with the patient, but maybe one day in one appointment, just give it a thought that maybe I need to screen this person for mental health challenges. So first, any chronic illness. I see in my population like a huge number of patients suffering from anxiety and depression who are diagnosed with diabetes maybe when they were 5 years old. So now while growing up, now that person is 26 years old and going through huge generalized anxiety and panic attacks. So I need to see, okay, if you are a diabetic specialist, your patient is in 20s and was diagnosed with diabetes when that patient was 7 years old. So one day maybe just give it a thought, like to check how that person is managing stress, how that person is responding to anxiety. Is this person going through maybe depression? So yes, treat the diabetes, but maybe one day just give it a thought and make sure that you screen this person for mental health. Secondly, IBS, it's very common. At least in Dubai, it's very common. Like, so as Dr. Give me your name, Nidesh? Nidesh. As Dr. Nidesh have explained that we have a gut brain, okay? So whatever you are gonna think, it's gonna impact your stomach. Or whatever you're gonna put in your stomach, whatever you're gonna eat, is ultimately are gonna impact your thoughts and your emotions. So any person going through IBS, like you know that it really increases, anxiety really increases the severity of the symptoms. Third is aesthetic surgeries. As I explained about bariatric surgery, actually maybe not in Nepal, for me also it was very different when I started to practice in Dubai. The trend to go for cosmetic procedures like Botox or different plastic surgeries. So, because it wasn't the trend back home. In Pakistan, we don't usually do it. So, but I don't know about Nepal, how much women are into beauty standards and plastic surgeries. But what I see a lot is so many aesthetic procedures. They are going again and again. Maybe you need to put little bit here or little bit here. Can I look like Kim Kardashian? Can I look like this? So, you need to just screen that is this person having any challenges with the appearance, or is this person is going to be satisfied with the procedure, or this person maybe needs some psychological help. Cancer, definitely our oncology department. Cancer, you know, like it's a very, very devastating for the family, for the patient, because it really brings this feeling of hopelessness. So any patient diagnosed with cancer deserves to have some psychotherapy sessions or some counseling sessions. Children with behavioral issues. You know that in our countries, autism, ADHD, defiant behavioral disorders in children, they are not really being recognized. So as a pediatrician, whenever you have any child coming to you and this kid is just not sitting, this kid is just not following my rules, just observe that what's going on with the child. Obesity, weight loss, like obsession with their body, weight loss. Is this person going through maybe eating disorder? Why this person binge eat, or why this person is trying to lose their weight? So just screen that, is it because that this person wants to be healthy, or this person doesn't want to maintain a healthy weight? Chronic pain, obviously, one time like I had tooth pain and it was so difficult to manage. Imagine like people who are going through different chronic pains, they are going to experience some hopelessness and frustration. And diabetes, obviously, like our gut, our diabetes, our hormones, endocrinology system is so much connected with our brain, how we feel. So just observe that how this person is managing. Okay? Now, those were the few medical challenges. I'm sure like the whole body or maybe the trend in Nepal is different. But what are the mental health challenges can be addressed in primary care? Okay. Now when we talk about it, it's more of like mood disorder. So most of the doctors here, we have one psychiatrist in house. Is there any other psychiatrist? You have 2? 3. Wow, we have 3 psychiatrists here. And how many clinical psychologists we have here today in the audience? None? No, okay. So amazing, we have 3 psychiatrists. So rest of the people, like when we talk about these mental health challenges, I would just like to refresh your knowledge, whatever you have studied back in your university or whatever you're observing, just we will refresh about the symptoms. Mood disorders, mainly depression, bipolar, mania, any adjustment, like it can be up and low, your mood, sadness, hopelessness, so mood disorders. Second is substance abuse. I'm not sure that what's the challenge here with the alcoholism or with the drug addiction, what are the facilities here, but whenever you're having any patient who is maybe addicted to any substance, just screen that, try to see what you can do about it, otherwise you can make a referral. IBS and stress, obviously, like just ask the right question, how that person is managing their stress. So whatever treatment you are giving for IBS or stomach challenges would be more efficient. Panic attacks, most of the time you will maybe see patients who are coming with so much exaggerated or elevated anxiety. So panic attacks, if you can manage that within that setting. Chronic illnesses, somatization, eating disorders. Now eating disorders, it's a huge trend right now because of maybe social media or the access we have to look at other people and to compare ourselves. So most of the time, like people, they go through different types of eating disorders. It can be binge eating, it can be, let's say, people are refusing to maintain their weight. They just have stopped eating, starving themselves, or they are just eating and going and vomiting. And domestic abuse. I would like to know from, what's a good name? Sorry. What's a good name?
I'm Dr.
Richa, yeah. Dr. Richa, I would really like to have some insight about what are the laws and what are your limitations when, if you receive a patient with domestic abuse or sexual abuse or physical abuse, how do you manage that or how do you proceed with that?
Okay, first of all, thank you so much. About the abuse and everything, obviously we tend to keep it very much ethical and keep it within the patient and ourselves. And obviously if it's concerning domestic abuse or sexual abuse, we do have to report the police if, in here in Nepal, if there is a consent from the family and the victim as well. But obviously we do have to concern about the patient's safety as well. So definitely about informing the necessary individuals and the necessary policy holders. That's very much important. But what I feel that since it's going to be between the patient and us, first of all, definitely the patient's consent is very much important.
Okay, so imagine if a patient doesn't give you consent and you as a professional observe that my patient is in danger, how would you proceed with that?
Okay, first of all, I'm sure like you know about the McNaughton's rule as well.
Yes.
And if there is a possibility that there will be a harm to the patient in the future, or there might be harm to someone else in the future, which is associated with the abuser related to the patient, then definitely we do have to inform the associated person as well. But keeping the patient's anonymity.
Okay. All right, thank you so much. For me, because it was very important to know, because every country, they have their own standards and policies and regulations. Thank you so much. So even like as a practitioner or as a GP, if you come and your patient is reporting like abuse, domestic abuse, just to give a little bit like empathy, show genuine interest, and talk with that person just so that person can be more open to talk about this, maybe in psychotherapy. Alright, so those are the things like a general practitioner definitely can do, but then there has to be a limitation. That's why we have psychiatrists. Okay, so you try to address the challenge, but if you see that that challenge is still they are not making progress, just make a reference to the psychiatrist. And when it comes to psychiatric referrals, definitely try to refer more like psychotic patients, and patient needing multiple mental health providers or multi-mental health team. Like you observe as a doctor that this patient needs a psychiatrist plus a psychotherapy, so you need to make a referral. Patient not likely to respond to time-limited psychotherapy, or patient not responding to initial medication trial. Like as a GP, the person came for anxiety attacks, you gave some medication, but still it's repetitive, just that time make a referral. Patients with more serious psychiatric problems than were initially apparent in need of specialty. So like when you saw the patient, maybe the patient's anxiety was around at 6 out of 10 or 5 out of 10, but now you observe that anxiety has elevated over time, so please make a referral. Okay, so now let's talk about screening. Like as a general practitioner, we are going to talk about the barriers, definitely, I know that. But how you can screen, like you don't have enough time to spend with the patient. Usually, how many minutes one doctor can give, like just a general physician? 15 to 20 minutes. So definitely, 15 to 20 minutes are not enough to open up or to little bit do the counseling. So how you can screen? So imagine like you have a patient and that patient is coming to you for a year and has different challenges. So maybe one day before your visit, tell your nurse to give one small screening tool to the patient. Just have a look at the score, and you just, okay, by looking at the score, okay, maybe today I need to talk with my patient about the possibility of going for psychotherapy or for psychiatric facility. So there are so many assessment tools, but mostly these are the widely used are PHQ-9 and DASS. Okay, so I think you all have received these copies, and they are available on internet. They are for free. Okay, so most of the doctors will give this form to their nurse. So when the nurse is screening the patient for your visit, patient can quickly fill it out, and your nurse can score it for you. And the moment you have a patient and you see that, okay, the score is very high and it goes for very difficult or extremely difficult, you would know that, okay, maybe today 5 minutes I can give to my patient talking about the possibility of psychiatric referral or psychotherapy referral. Okay, so you can have a look at that. If there will be any difficulty of understanding, all the instructions are on the internet and on the back side of the paper. So these two tools easily you can use to screen your patient for the possibility of referral or opening up about mental health. Okay, so yes, it's a long way to go and long way to reach over there. Now, as he said that in Nepal we have a different facility comparative to Dubai or to any developed country. We have so many challenges that we face, like, okay, I wanna reach level 3 in my hospital to make a very close collaboration, but I don't have enough resources. So let's talk about those barriers. There are few barriers that we observe in our organization, and then afterwards you can share with me what are the limitations you have, like you would want to do it, but it's not possible to do. Competing demands and tasks of primary care providers. As he mentioned, that the average appointment time is 15 minutes. Okay, sometimes it's not even 15 minutes. And most of the time in government sectors, it's like a 5 to 6 minutes appointment. Like quickly, you have so much to do because average appointment time is 10 minutes. You don't have enough time to talk about mental health or for the counseling. Number of problems on problem list. Your patient is coming to you like after a month with a long list of problems. I have headache, I have this, I have pain here, I have there. So you need to prioritize, okay, what I'm gonna talk about it. So mental health really goes on the below of the list. Zero-sum game means like, okay, you have limited resources. Either you have limited billing codes as well. So either you address this or that. It's going to be really difficult. Now, limitations of specialty mental health services from primary care setting is like prescription monitoring of psychotropic medication. Like, I'm not sure about Nepal, but every psychiatric medication is very controlled in most of the developed countries. So, prescribing that medication, monitoring the progress and the dosage and the usage, sometimes it's very difficult for a primary care physician to monitor that. So that's why we spoke about that you address most of the challenges that are manageable within the primary care, but when you see that this is my limitation, more than that I can't do that, you need to send it to the psychiatrist. Then we have insufficient training. Obviously what our psychiatrists are equipped to do, we all have our limitations within our profession. And billing codes. And about billing codes yesterday, interesting enough, I had a conversation with Megha, and she told me that there is no insurance system here. Yeah? All the medical facilities are cash payer. Right? Some companies, yeah? Okay, so yeah, so, but for us, like billing codes, sometimes a primary care physician or GP cannot prescribe specific kind of medication because insurance would not approve that code because that code has to be sent only by the psychiatrist. Okay? So when it comes to insurance and billing the insurance, there are limitations for primary care. That time only psychiatrists can do that. Okay? But over here it's more of like a cash payer. Yeah? Okay, now what are the patient barrier to providing mental health services? We spoke about as physician and the facility and the resources, stigma of psychiatric diagnosis. Like in South Asia, in Pakistan, India, Nepal, only just talking about mental health is so much stigmatized. We don't just want to open up about it. And there can be so many reasons for that, like the link that, okay, people will think I have gone crazy, or what they will think I'm not strong enough, or they will perceive me as weak, or there are no such facilities. So stigma, we don't open up just because like what other people are going to think and what they are going to perceive. Significant negative consequences, for example, negative consequences from a job. If you are in a job where you just tell like I have maybe ADHD or I have depression or I have this, maybe the attitude of your employer would change towards you. So because of that, most people would not want to open up. And maybe the attitude of family members would change towards you. Problems not perceived as psychological, like this is huge back home in my country. it's very much dominant by the religious practices. So if somebody is going through any mental health challenge, families would like to take them to the spiritual healers. So back then, like 1 decade ago, it was a huge practice back home. But now, for the past 10 years, so many things have changed and there's a huge progress. So I would like to know that what's the trend in Nepal when it comes to traditional practices of mental challenges rather than going to a psychiatrist or a psychologist. Let's talk about the religious perspective. Who would like to share with me?
It's still there.
Yeah.
It's still there. Definitely, it's very much prominent. People still do go to the traditional healers to seek help initially rather than going to a psychiatrist. But what I personally advise them is that if you do have spiritual and religious beliefs, do go. Okay, so if some of them do have spiritual and religious beliefs, and their family members do have that strong belief, why not take both of them hand in hand?
Yes, yes,
Yes,
definitely.
definitely go seek the traditional healing, those methods as well, but do come for psychiatric help and take help from us as well.
Yes, definitely.
I'm Norvic here. I'm assistant professor in Bottom School, and we have a team of professors and psychiatrists in this table too. So I just like to add what just Richa said. But if we see the results of National Mental Health Survey, the data shows that if we just saw the pathway to care, then majority of the participants, they approached non-psychiatrists and faith healers more than coming to psychiatrists. So this has been the usual experience to all of us, but the National Mental Health Survey was itself a big show to the world that yes, the pathway to care is very much late for the patients to come into psychiatrists. So what I would believe is when we talk about integration, then yes, including these faith healers into the whole diaspora of mental health treatment is very important. Such practices has been done worldwide, especially in South Asia. In South India, there is a famous temple where there are outreach clinics of mental health conducted by NIMHANS, the very popular mental health institute, which really showed that access and awareness of that area really improved. So yes, we can't simply negate the importance of faith healers in our community. If we could create a sort of collaboration, it would be the best, because faith healers are an essential part of our whole ecosystem here.
Yes, yes. Definitely, and me belonging from Pakistan and growing up in a family system where belief is the foundation of any family system, whenever a client comes to me or goes to any psychologist or a psychiatrist, it's a very important area that we need to explore. What are the beliefs and how strongly those beliefs are? So you integrate your approach accordingly. And as he said, there are 3 hearts. And when we talk about beliefs, whatever you believe is going to happen. If you believe that this is what is going to work for me, that will work. So the point is you need to believe. But here we're talking about more of like families would not want to take the person to the doctor or to the psychiatrist. That time it can be really challenging. And limited finances. Obviously our budgets, our finances is a huge barrier to provide any intensive, comprehensive treatment. Okay, now we know all these limitations, we know all these barriers we have, what we can do, what you can do, okay? So it's very simple. Start where you are, use what you have got, and do what you can, okay? Now, it doesn't matter if your organization is on the level 3 in terms of collaboration or is on the level 1 in terms of collaboration. If we genuinely want to make change, we can just start within ourselves. If I want to spread awareness about mental health, I need to start within myself. First, I need to recognize my emotions, being able to express my emotions, and being able to validate my emotions. So maybe my siblings will have a look at me and they'll be like, okay, she's sad. So she's not afraid to say I'm sad. So then they will start doing that. And then maybe their friends. So one person can definitely impact 10 other people. And this is how we can really contribute our services or our part into spreading awareness. Now when it comes to general practitioners or doctors or any other medical facility other than psychiatrist or psychologist, what you can do, you don't have resources, you have so many limitations. Okay, so let's talk about few of the psychological maybe statements or maybe tactics you can use to open up to your patient. So being present with the distressed patients. Now you know like your patient is going through maybe any chronic illness or cancer or any type of surgery, it had a negative impact. Just be present with them and how you can actually do that. Body language. The most important practice we observe when I go to a GP is on the computer and me, I'm talking. Now I'm going through this huge infection and if I see my doctor has no genuine interest in me, I will not feel good about that. Okay? So just time to time in your appointment, I know you guys have to make prescriptions and being like the notes and everything, but just for a moment, leave your computer and look at your patient. Give eye contact. Okay? So reflect that from your body language. Listen. Just listen. And most of the time our primary care doctors, like they do talk a lot, advise a lot. But time to time, just try to listen and instill hope. How you can do that? By giving few examples, like your patient is coming, going through maybe IBS and also have anxiety, also have panic attacks. So just try to instill little bit hope in one sentence. Just remind that person, ask him, so in the past, whenever you had these challenges, how did you cope with that? So maybe that person will reflect, okay, I was able to manage that also. Just maybe a little bit give example from their past. So whenever you had a difficulty in your past, how did you manage? What type of support did you seek? So just give them hope. Second, encourage the patient to draw on social support, as we spoke about, like our connection, our need to connect with others on emotional level is so much important. So just advise your patients to be more connected. Increase the frequency of visits with you. If you know that patient is not ready for psychiatric referral, doesn't want to do it, just to maybe increase visits, specifically in domestic abuse or maybe physical or sexual abuse. If you are not in a position to report that or to do something about that, at least increase your visits with that person. Teach breathing and mindfulness exercises. This is so much important, and I think in Nepal, in India, overall yoga is so much common. Okay, and breathing techniques are so much important. So maybe just for 2-3 minutes, if you can teach your patient how to take deep breaths, how to be more mindful about life, that can maybe help him to adjust with the life in a more better way. So how many of you are aware with the diaphragm deep breathing, square deep breathing? I'm sure you all, but I think that, okay, so how we can take deep breaths?
Well, there are several methods.
Several methods, yes.
Mostly it's a deep inspiration, deep expiration.
Yes.
And there's also forceful expiration.
Yes.
And also just slow breathing out, and then also holding the breath.
Yes.
For a long time. You know, like I do, I can hold the breath for 6 minutes.
You can? 6 minutes?
6 minutes.
Wow.
And then other things that like sounding like oh.
Yes. Yeah. Okay. So yes, as he said, there are so many methods for deep breathing, but the most common one is the square breathing, in which we, let's say, very seconds, hold that breath in your stomach for 6 seconds, and then exhale that breath from your mouth for 8 seconds. So exhalation needs to be more slow. So do this deep breathing. That will have a huge impact on how that person is managing their stress level or reacting in certain situations. So just promoting that. Encourage behavioral activation by helping the patient create a routine or schedule, like tell them to be more active, to see more people, go out for coffee, do something, little bit of walk, and assist the patient in focusing on gratitude. It's so important to be grateful, to practice gratitude. So just maybe have a 1-minute chat with your patient to just observe that how that person, on which point that person is standing about the gratitude. Okay? So next we have focus on the specific issue you are observing, but avoid labels and psychiatric diagnosis. And how you can do that, like usually if you use this statement, I know you have lost your appetite and have not been sleeping well since you lost your job. Okay? Over here, you just told that person that you have noted 2 specific symptoms of depression rather than focusing on the level of depression. Okay? So using such statement that I know that the loss of appetite and the loss of sleep is connected to you losing your job. Okay? So maybe that time your patient is gonna open up more. Yes, that's how I have been feeling since losing my job. Then normalize the emotional response and express empathy and concern. How you can say, it's common to feel a lot of strong feelings after a parent dies. Being angry at the world, confused, sad and lost. I know how close you were to your mom, and I can tell you are really sad and hurting. And I feel sad seeing you in such a pain today. Okay? So just like using such statements, you know, like your patient has lost the mother or any family member or a friend, just sympathize with that. Empathize, show your genuine concern and normalize it. The emotional response patient is having, normalize that, and maybe this will give them opportunity to open up to you. Then note how mental health is related to physical health concerns. And how you can do that, just by using this statement, and I'm sure all of you have your own statements, your own ways. I wonder if your stress or sadness or anxiety is making your headaches, okay? Or nausea, back pain, worse. I'm curious what connection you see between the two, okay? Rather than you telling, like, okay, you have anxiety and anxiety is because of this, you go to a psychiatrist. They will not go because already there is a huge burden of stigma for them to seek psychiatric help. So you just normalize it and make them think what's the connection between it. Okay? Maybe the stress he has or the headaches or the kind of panic response that patient gives in state of stress, will be able to think about it. Emphasize the power of your relationship and the team approach, okay? Now imagine we have 2 departments. We have mental health department and you want them to see a psychiatrist or a psychologist, but patient is not ready. So how you can actually encourage that? You can say, you don't have to go through this alone. I'm here and I want to support you in this difficult time. We believe so strongly in addressing emotional issues as part of your overall wellness that we have behavioral health department or care provider here in the clinic. For example, you can take name of Dr. Richa. We have Dr. Richa has helped a lot of my patients and I think she could help you too. Would you have few minutes to meet maybe Dr. Richa? Okay, so just to say that in the past, I had a patient with same challenges. I sent him to Dr. Richa and he got better. So why don't you just think about it? Instill hope by noting that additional treatment can help. I have observed that others in your situation have found that talking to a counselor can be really helpful. How would you feel about that? Okay. So just give few examples from their past or from other patients and encourage them to go for psychiatric visits. And that's all from my side. Although mental health topic is so vast, so huge, we can talk about it days and days. And I feel excited, like I want to share everything I know and I want to learn everything you guys know, but we have to stick to our topic and to our time and the limitations. But questions are welcome, and I'm very open to know your perspective, and if you guys have any question. So let's do some question answer session. Let's start from this table. Because I know audience are like that. They would not want to share until you just go and approach them. And that's how you need to approach your patients. They will not open up to you about their emotional well-being until you approach them. Okay, so let's come to this topic.
Okay, Dr. Julan.
Yes, any question you have?
Just a few comments. I agree. One of the things, whom to screen. I think everyone visiting a physician or a healthcare provider, we should have the responsibility to screen everyone for mental health because it's part of being healthy. So simple thing like spending more time with the patient. That's one of the most important things. And if you have built a good rapport with the patient will open up with you. And then the eye contact. And in my practice, I think elderly patient population is the one that has huge burden of mental illness or mood disorders. Because they are subject to elderly abuse, which no one talks about, the patient is scared to talk about, and these elderly patients are usually brought in by their family members, so they would not open up in front of them. So it's very important, and especially in my practice, like I'm a neurologist, so I see a lot of Parkinson patients. And one thing we have noticed over these few years is treating mental health is very important in patients with Parkinson because the Parkinson medicines do not work well if they are not feeling good. So that was a comment, and yeah, I think mental health is important and everyone should be seeing it.
Yes, sure. Thank you so much for your feedback. Thank you. Let's go to this table.
Dr. Kamachi.
Hello everyone, I'm Dr. Kamaksasha. I'm an endocrinologist at Norvic International Hospital. So I just have a few comments. Like you said, like talking to patient and counseling the patient about the disease is so important.
Yes.
Because in the end, patient will forget all the, patient will be less anxious when they go out from your OPD. So the counseling and talking to the patient about the disease is so important. And like Dr. Ponga sir said, like I deal with chronic disease like diabetes, right? So none of the medication will work if patient's mental health is not good. So mental well-being is so important in chronic diseases like diabetes and disease.
I totally agree with you. If patient is anxious already about their blood glucose or hopeless about the life, like recently I had one patient with a severe major depressive disorder. So she refused to take care of herself or to give her the right dosage of insulin just because she believed I was diagnosed with diabetes when I was 5. I'm gonna die soon, or I'm gonna lose my eyes, or I'm gonna lose any body part of mine. So what's the point to take care? So it's very important.
Thank you.
So who we have from this table? I think you are interested.
You see that you encourage people, they don't talk.
Thank you everyone. I'm a psychology student. I have done bachelor in psychology recently, and I also want to pursue my master's in clinical psychology. So this session is, I'm sorry, I'm so nervous. This is my first time.
So yes, that's very normal.
Okay, so this session is like, this session will help us to know more about like primary health and general physician, how it works. I mean, mental health. Okay, I'll ask you one question. Like, why there is no license system in Nepal in psychosis? Like we don't have license system.
Yes.
Like
I
we,
am the wrong person to ask the question.
definitely. We have done our masters. We are like clinical psychologists, but people who done like 6-7 months training, and they also do same work like really.
Yes. I actually, what's your good name?
Rita Regni.
Rita, right?
Rita Regni.
Rita.
Yeah.
Okay. So I have observed that like in many developing countries, as we know, like psychological health is not so much promoted, and we can observe that from our licensing system. So majority of the countries, developing specifically, they don't have this system. So somebody with a degree in bachelor's in psychology and with master's or with PhD is doing the same work. And that's the more harm to our population, because we are not establishing a standardized practice. So, but why Nepal doesn't have it, obviously, I don't know. So, maybe in the future it would come. But let's talk about Dubai. Like in UAE, everything is regulated by Dubai Health Authority. And to get a practice license as a clinical psychologist, it's a long procedure, series of exams. And then even to maintain your license, every year we have to go through specific CPD, CME, and some certain trainings. And that's how we maintain our standard. Yeah.
In Nepal, like we don't have lots of clinical psychologists here. If we are like applying anywhere after completing my bachelor's or master, I'd like to apply in the clinical, in some hospitals. Like they ask for experience. Okay, so obviously we are fresher and we don't have any experience, and without having license, they will not
hire you.
Yeah, and even like I've seen Norvic hospital psychology department list. They have doctors or psychologists who have done masters from USA or from like outside of the country. There is no one from Nepal, and it's so hard to get job as well.
I can understand that, and definitely that goes back to the question of how many institutes are providing the training into clinical psychology. So, because yes, you can do bachelor's, but that's not sufficient enough to practice as psychotherapist. So I'm sure Nepal as a country, or maybe colleges, medical colleges, they all would work together to make it more standardized. Yeah?
Thank you.
Yes, Harish.
Just
Sorry. Back to you. Yes, that's the right person to ask this question.
I think we have NHPC, Health Professional Council is there. They do provide you certificate for clinical psychologist, okay? So, okay, there are some training for 6 months, 9 months, those, but they are not officially recognized to practice with the patient. They have to have MPhil degree minimum.
Yes.
And PhD degree,
yes,
to work in medical school or to work in big hospital, okay? So clinical psychologist. And if you just visit NHPC website, you'll get everything. So without license, they are not entitled to practice in clinic. But as it is said in developing countries, okay, there are quacks and a lot of people are there, even if they have received minimal, training for anything, they are doing practice. But one misnomer here, especially in developing countries, counseling means talk therapy, give advice.
Yes.
That is misuse of psychology, okay? That is there, I think. Even in developed countries also I have seen. So that is why, but we have to be very cautious. But there is NHPC, proper council is there. So please do not say that there is no license system. There is. Without that, you are not entitled to practice. Thank you.
But that is not being followed.
No, it is strictly followed.
Okay.
Strictly followed. Without that, one is not entitled to practice in medical college as a lecturer or in big hospital. They have. Without that degree. And like in Norvic hospital, say I am also working in part-time in Norvic hospital, but I did my MD from Nepal. It's not so. Oh, yes, I have done my geriatric psychiatric from USA. So additional degree we may have done. There are a lot of people, and this is a very beautiful country, and we accept, like she is from UAE, Pakistan, practicing in UAE, and she is speaker here, okay? Give her a big clap for her, first of all. She will. It's a very beautiful country. We welcome everyone. He's a director in our hospital, Patan Hospital. So I think you'd like to say something also.
Yeah, just give me a minute, sorry. I would like to add something what she spoke about. I think in developing countries like Pakistan and Nepal, we just have this inferiority complex about what we have is not enough, and we look forward and we look towards West a lot. So it's just a mindset of people. Even in UAE, we face this. Like, oh, this person is from UK, I want to go. Okay, where is she from? She's from Pakistan. Oh, I don't want with Pakistani doctor. So this is the inferiority complex. It's a generational trauma we carry from our forefathers. So it's so much important to recognize what we have and how we can make it better, rather than thinking about what we don't have.
Thank you. Since the mic is close by, I was also tempted to speak.
Sorry.
First of all, namaste and good evening to all. Thank you, Norvic, and in a way, it's a congratulations to Norvic Hospital also that you have taken mental health as a topic to talk about. By the way, most of you must be aware that October 10 is the Mental Health Day, and October is the whole month of Mental Health Awareness Day. I think this is a stepping stone. If the private hospitals have come up to in this advocacy of mental health, I think this is a beautiful thing. A clap for Norvic Hospital also. And then of course, welcome to Nepal.
Thank you.
Sorry, I missed a little bit in your initial. Anyway, I think as he said, Nepal is a beautiful. I'm sure this is your first one.
Yes.
Yeah. So welcome and enjoy our whole cultural as well as scenic beauty, everything. Anyway,
Yes.
I don't know how long will you be here. What I wanted to speak about is that I was really worried that you are carrying some misconceptions back to UAE, so I just wanted to have a few things.
Yes.
The first thing is that, of course, we have all the mental health professionals, and it is one of the fast catching up area. As you can see, even private hospitals are also now talking about it. So it seems that it's catching up.
Yes.
And then we do produce mental health professionals, right from the psychiatrist or even nursing professionals, means psychiatric nurses, and as well as clinical psychologists, and then including our own hospital is also producing psychiatric nurses as well as psychiatrists, and we have undergraduate training, and the mental health is very widely covered. And it has been emphasized in past, let's say 20 years or so. Mental health is a must for any medical professionals. So it's catching up. Of course, it's not enough. It's not enough. It's catching
We have a long way to go.
Yeah, definitely.
In my country back home, we have a long way to go. It's catching up.
And then just to clarify some other discussion to our friends, Nepal do have health insurance, and it has been catching up. It's not very old. It's around 9 years old. And then it has covered almost 70 districts. That we have 77 districts, and it has covered. Of course, it's not very popular. There are practical problems and all this. And majority of the hospitals are enlisted for giving this insurance services. The government pays with a limited. They have to pay around 3,400 rupees, 3,500 in a year, and then they'll have a coverage of around 100,000 rupees in a year per person. And then even the family can get involved. And then recently, the Social Security Fund, the SSF, that also has come, which also helps in healthcare. And then, fortunately, even some of the psychiatric illnesses are also covered. And we have representatives from WHO and all. We have a very good supply of psychiatric medicines, even at the primary healthcare centers. We have developed so-called mental health gap project, so that even the health assistants, means the non-doctors also can prescribe some of the psychotropics that is being practiced in Nepal.
What do you mean by non-practice?
No, I mean, they are not MBBS doctors, but they are health assistants, health assistants, and community paramedics. Yes, exactly. But even paramedics can do, but limited. To my knowledge, 15 drugs are available. 11 drugs are available. Even the remotest of the primary health centers. So it is available.
Very nice to know.
Yeah, and then lastly, just comment to you that it was a pleasure exchanging your perspective. I'm sure we all have things to exchange and learn each other. Thank you.
Yes, definitely. Thank you so much for your feedback.
Dr. Ira?
Yes.
We should back to her.
Good evening, everyone. Actually, I wanted to add something. Like I say, common mental challenges can be addressed in primary care. I wanted to add like trauma, which we had, should also be added in this category because trauma also plays very important role in our mental illness, maybe, yes. And if the person is suffering from any kind of trauma, it can go directly to affect our mental
illness. Yes,
definitely. Yes, that is what I wanted to add. And next thing is that I wanted to ask to every person over here, every doctor, psychiatrist. I am a clinical psychology student final year. I'll be graduating soon. And I wanted to ask, like, what kind of relationship is there between psychiatrists and psychologists in different hospitals in Nepal? As a student myself, and I want to pursue in the clinical psychology, how can psychiatrist, doctor help me as a psychologist in future? I wanted to.
So the relationship between psychiatrist and psychologist, it's just like nail and nail bed, you know?
Yes.
That's simple. The rest we can talk once this forum is over, otherwise the people would get bored. Thank you.
Let me just add, the modern mental health team comprises of not only psychiatrists, clinical psychologists, and even social workers, psychiatric social worker, occupational therapists, and even psychiatric nurse. So 5 teams. So we can work together. Come on, let's work.
And as you said, there is organization, so you can proceed with your licensing and get an opportunity. Okay, so here.
Hello everyone, I am Dr. Bhusan Shah. I am working at an NGO, Sports Nepal. I work in opioid therapy center. So I basically see the substance abuser, opioid drugs abuser. The patients who come to see me, or the patients whom I see, I usually prescribe them methadone or buprenorphine. And there also lies problem when I prescribe buprenorphine to someone. The patients, what they do, they usually try to split the buprenorphine and take that away from our center and later inject in their veins.
Yeah, so the misuse of medication.
So this problem should be solved soon. The buprenorphine tablet can be replaced with one combination with naloxone. They can do that, but I don't think anyone is trying really hard to solve the problems, solve the issues. And earlier, doctor said that even paramedics can dispense psychotropic drugs, they can prescribe. Problem lies there also. Pharmacists dispense psychotropic drugs on their own. So I find patients who are misusing tramadol, clonazepam on their own. They take a lot of number of drugs. So that is not good.
Definitely, I mean, in any country or in any place, you always have different types of people. So when it comes to prescribing the drugs, they need to make sure that it's not being...
Pharmacists don't even try to get prescription and to dispense. They dispense on their own. If they know the client, they usually give because they get money from there.
Yeah, that's why I think health regularities, they need to...
There is no regulation as such there.
Yeah, that's a discussion.
Yeah. Thank you.
Thank you so much for your comment.
Experts on addiction medicine.
Thank you, sir. I'm not the expert, but then I have interest on addiction medicine. But being trained in India, addiction psychiatry it should be mostly treated by psychiatrists and the team which we just discussed in a health setup. But if we see the difference between India and Nepal itself, I'm not aware about Pakistan, then we have rehabilitation centers who have more onus. But as the team must be struggling with such various issues, it may be because the psychiatrist and the team is not adequate enough and the resources are lacking. So if we have such a team and hospitals and
Definitely.
treating such conditions. It's much easier because of my training at AIMS and ADTC, which is one of the main WHO collaborating centers in India, we had a very least of such issues there because it's mostly been done by psychiatrists, psychologists, experts.
So depending on the situation, obviously environmental factors. Thank you so much. Thank you. So,
Namaste. I'm Dr. Pravesh, working as a pathologist at Norvic Hospital. And Dr. Ira, it was a very good session.
Thank you so much.
And I think this should be carried out in the rural areas also. Because there is like a social stigma that a mental disorder is not good outside the house. What neighbor will say, this should be break up. So there must be awareness in a rural area in these things. In content development.
As we spoke about, yes, maybe in the past 10 years we have grown a lot much better than before, but there is still so much work needed to be done. And it will happen if we all are open to talk and to actually address these challenges.
Thank you so much and enjoy it.
Thank you. Would you like to add something?
Dr. Iran, thank you so very much. The last part of your presentation, that was where I was really fixated, because that is something that all of the doctors here, we should understand, that we should normalize the patient's emotional distress that they are going through and advise them and encourage them that whatever you said, I did send my other patient to a counselor and it did help them. So would you like to try? So that was the statement that really caught my eye. Thank you so very much.
It was. Is this the media team? Yeah.
Thank you.
Yes, we are done.
So, my question is, how are the organizations in Dubai, or let's say in your hospital that you work at, what is the corporate policy of your hospital for employees' mental well-being? So, policy that we need.
So when it comes to, that's going to be a very diplomatic answer because I can't say something that is not going to serve me better. But when it comes to organizational policy, the hospital I work at is 25 years old. However, this is the third year that they have started a psychiatric facility. So from there you can understand that it was not something that was addressed before, but now after opening up the department and seeing that this was the huge need during COVID, they have started to implement so many programs to address the employees' mental health, and obviously because in most of the insurances they don't cover psychiatric illnesses. So our hospital has provided this opportunity to the employees to see our team or outside on a very reduced cost. Thank you.
Good evening, everyone. Thank you so much, Dr. Ira, for your very insightful presentation. I'd like to ask that I'm a public health student, and I have read somewhere that medical dualism approach, that means integrating traditional medicine and modern medicine in parallel way. That would be very effective. There is some research happened about the medical dualism, and it mentions that it would be very effective for the mental health promotion and prevention. And my question is, what is the possibility of approaching this approach in developing country like ours?
Okay, so as we were talking about holistic approach means that whenever I receive any patient in my clinic, so during the clinical interview and understanding the patient background, it's so much important for me to understand the religious belief or the belief that person is practicing, or the kind of family system, how much social support is there, and traditional medication. But when it comes to traditional medicine, I usually don't make referrals for that. Like psychiatrists are the one who can really explore that area. But for me, I'm really connected with a few organizations or institutes in the same city or some other countries where it's a lot of yoga, meditation, this Ayurvedic treatment for maybe 20 days, 21 days. So that usually I recommend my clients, and that's how you can integrate both areas. Thank you. Last.
Thank you. My name is Dr. Umar Manpradhan, and I'm an emergency physician. So basically, when she talked about the trauma, then I was like caught with that. Why was that missing in this session? So basically, when in emergency, when anyone comes with trauma like accidents, especially, they are usually young, very young. And when we talk about the psychological or mental health, we are not only talking about the patient, we are talking about the family who is involved. So we have to not only counsel the patient, but also involve the family who is involved in this whole scenario. So another part that is very important is the whole heading of this session, which is integrating the primary health. And I would like to thank you for, I think we should practice at least giving the questionnaires to this thing. And I think elderly neglect, as Sir said, has to be one of the key aspects to work on.
To be addressed.
Yes.
Yeah, definitely.
Thank you so much.
Thank you so much for your feedback. Since my arrival to the airport until today, what I have observed, and my brother, he's here with me on the trip, Khadija Brand, we have observed, and we were talking even yesterday, the overall attitude of Nepali people is so positive. They are so welcoming and very genuine and very calm. So this calmness, I think it has a lot to do with the maybe nature that we miss a lot where I work. So overall, my experience is so great. Thank you so much for giving me this opportunity. It was a very nice session. I got to learn so much from all of you, from your perspective, what you guys have been practicing. And as we say, yes, we have gotten so much better, but still there is so much more we can do about it. And what you can do is what you have. Just start talking about yourself, your family, your friends. Focus on listening rather than advising. And this is how we can spread awareness. Just talking about mental health or sadness or depression, this will make a huge difference in the coming 10 years. Thank you so much for all of you. If there is anything you want to talk to me, like maybe during the dinner, we can have a chat. Okay? Thank you.
Thank you, Dr. Ira. Thank you for such an insightful presentation. Now, I would like to request our MD Megha Chaudhary to please come on stage and provide token of appreciation to Dr. Ira. Dr. Ira, I would like to invite you also on the stage. Dr. Ira, can we have you on the stage, please? Yeah, that's Nepali window.
Thank you so much. Thank you for the Thank you so much.
Now I would like to invite Mr. Rajendra Singh, Chairman of Norvic International Hospital, for the vote of thanks.
Good evening. Respected Chief Guest, Key Speaker, Dr. Irani, Managing Director, Norvic Hospital. Respected guests, doctors, dear colleagues, my media persons, ladies and gentlemen. I am honored to offer my sincere gratitude to Dr. Naeem, our esteemed guest speaker who has taken time from the busy schedule to enlighten us all on an issue which is burning important in this current world. My hearty thanks to all participants and distinguished guests for your active participations and warm presence in these August gatherings. As we have all experienced over the last decade, psychological impact of day-to-day life challenges, adverse life events, and persistent stress in our day-to-day life has significantly increased the number of people seeking help. Without integrating the mental health awareness in our communities, healthcare providers find it difficult to meet the challenges faced by them in providing the comfort and required to enable individual adults and children to live a more happy and healthy life. I am sure all we agree with me, Dr. Iraj, said experience will help us in planning our own community-based approach to mental health issues. Last but not the least, once again I invite you all to thank Dr. Iraj, and my special thanks to management team for excellent preparation to make the grand success of this program. Thank you.
Thank you, sir. As I initially said, behind smiling face can be the crying heart, which is difficult to read and interpret. So, mental health is not a destination, but a process. It's about how you drive, not where you are going. Let's make mental health and well-being for all a global priority. Thank you very much. Now, I announce the end of the session, and I would like to invite all of you to join us for the cocktail dinner. Thank you very much.